For coming today. I'd just like to welcome you to the launch of the Drug Situation in Vancouver report. Before we get started today, I would like to invite Tracy Morrison to begin the event with an opening acknowledgement. Thank you for attending here today. Tracy is the current president of the Western Aboriginal Harm Reduction Society.
Thank you. If you all can stand and take off your hats, please. I'd like to do a territory acknowledgement. We'd like to acknowledge that we are located on unceded Indigenous territory belonging to the Coast Salish peoples. Based on our current knowledge, this includes the lands belonging to the Musqueam, Squamish, Solo, Tsleil-Waututh, aka Burrard Nations. Today, most of BC remains on unceded sovereign native lands over which neither the Canadian or the BC governments have the legal or moral authority to govern. We gratefully hold our meeting here today on their lands and promise to have our gathering and our voices and sharing forward Indigenous futures. All my relations, thank you.
All my relations, thank you. Thank you very much, Tracy. Greatly appreciate that. So thanks to all of you who've taken the time to be here today. We greatly appreciate you attending, taking time out of your busy schedules. And we'd just like to say a special, yeah, if we can get a little more volume on this mic. Oh, sorry, there we go. Special thanks to all the people who have shared their life experiences and taken time to participate in our research projects. And that makes this report possible, as well as our broader research program. So my name is Will Small. I'm a research scientist at the British Columbia Centre for Excellence in HIV/AIDS. Very pleased to be here today at this launch. Give you a little bit of background information about the Urban Health Research Initiative, and then we'll move on to the launch of the report itself. So the Urban Health Research Initiative, which we call UHRI, or UHRI, as I'll refer to it sometimes during the event today, is a program of the BC Centre for Excellence in HIV/AIDS and was established in 2007. The mission of UHRI is to improve the health of individuals and communities through research to inform policy, and the program is led by principal investigators Dr. Evan Wood and Thomas Kerr. UHRI is based on a network of studies that have been developed to help understand the many factors that affect the health of urban populations, with a focus on substance use, infectious diseases, the urban environment, and homelessness. The report that we'll be releasing today is a comprehensive report intended to provide government agencies, service providers, advocacy groups, the public with a clear picture of the drug use trends and behaviors in the downtown East Side area so that people may develop relevant evidence-based policies and perspectives. We've got the Ministry of Health and some other individuals on a conference call here as well, so I'll just ask the speakers to pass this along as we're turning the mic over to each other. So I'm just going to quickly cover the plan for today. We have Dr. Thomas Kerr here. He's the co-director of UHRI and one of the report's authors. He'll be introducing the report and outlining its findings. We're also joined by Lorna Bird and David Ham, who will make some comments on the report and the drug situation in Vancouver more broadly. They're here on behalf of the Vancouver Area Network of Drug Users, VANDU, and the Western Aboriginal Harm Reduction Society, WARS. A few housekeeping matters before we get started properly. Before I begin, I'd like to remind the media that you're invited to record the proceedings, but the last two rows of seating at the back of the room are reserved for people who prefer not to be caught on camera, so if you could please respect those people's wishes and their privacy, that would be greatly appreciated. I'd also like to take a moment to thank those of you in the audience who are helping to share the findings from this report online through Twitter and Facebook. We ask that if you're doing so, that you use the hashtag DSIV, so it'd be hashtag DSIV, so that we can keep track of your reactions and other people's reactions to the report. The other thing is that we have quite a full schedule, so it's going to be important for us to keep to time. If people go over, I may need to interrupt you, and we'll have some time at the end for questions and answers, questions from the audience and answers from the panel. So I'd like to invite Thomas